So good day to each and everyone. Good day, ma'am. I am Marijan Valleta Katubig and I am assigned to report the prevention and the nursing assistant responsibilities of our topics. So let's go first in the prevention of fracture. So what can you do to avoid fracture? Many fracture can be avoided by remaining in shape, avoiding falls, and getting the correct vitamins and minerals. So avoiding falls. Following certain tips can help you stay upright indoors and outdoors. So indoors, balance. If your body is out of balance, consider balancing training and physical treatment. So you can also use cane or walker if you need to. Balance exercises help your muscle work together in a way that keeps you more stable and less likely to fall. Next is the clutter removal. Keep your rooms clean and organized. Ensure that there is no wires or cords cross your pathways. So, through this, we can avoid falls, most especially where you're in a hurry. We can't deny the fact that if we're in a hurry, we don't know or see what we are doing or what might happen, as long as we can make up the plan on time. So this prevention is also a big help. So next is the lights. Make sure your rooms all have a good lighting. So through this, we can be aware on what's on the floor or on our surroundings that will keep us out in the danger. So light is very important to light our way and the surroundings. Next is the rugs. Use kid-free mats under any rugs you need. Next is wear shoes, not just socks when you're at home. So wearing suitable shoes for your activity can help to avoid sprains, strains, and even fractures. Hiking boots with ankle protection can protect you from injury if you're walking or uneven surfaces, while cushioned running shoes can help you avoid stress fractures. So next is the vision. Check your eyesight with an eye exam by an optometrist. So it is very crucial to check your eyesight with an eye exam by an optometrist for us to see clearly what's on our surroundings, most especially in our way, and through this, we can be able to avoid the possible obstacles or problems that may occur someday. Next is the outdoor. First is the attention. Pay attention to your surroundings. So, watch for anything that could turn into an obstacle or cause you to trip. We really need to be alert and observant to our surroundings. Next is the balance. Use a cane or walker and wear rubber-soled shoes for a better grip. So I already explained this earlier, so let's move forward to curbs. Take care at curbs. Watch your footing as you step up. So while taking curbs, it is still necessary to watch your footing as you step for your assurance to not to fall. Next is the lights. Leave porch light on if you will come home after dark. So I already explained this earlier, so let's move forward to the weather. Keep sidewalks, driveways, and steps free of ice and snow. Use salt to help keep them clear. So let's move forward. So staying fit. Walking is a weight-bearing exercise that keeps bones strong and healthy. Exercises that build or maintain muscle can also help you improve your balance. So weight-bearing activities such as running, breast walking, jumping jacks, and strength training produce a force on the bones. So these activities can help promote bone growth and bone strength and reduce the risk of fall-related injuries and fractures. So next is eating right. Maintain a healthy diet to promote bone strength. Make sure you obtain 1,200 to 1,500 milligrams of calcium per day. So vitamin D should be consumed in a range of 800 to 1,000 units. So certain foods provide good sources of these nutrients such as almonds, beans such as chickpeas, black beans, and tofu, dairy such as milk and yogurt. Next is eggs. Next is vegetables such as broccoli, spinach, and kale. Next is whole grains such as brown rice, oats, and rye. So, after fracture, your bone needs to rebuild. A healthy, well-balanced diet rich in key nutrients can help us speed it up. So let's move forward on how to manage bandaging. So a hand fracture occurs when you break one or more of the bones in your hand. So when bandaging your hand, take the following precaution to ensure a smooth healing process. So first, make sure the bandage isn't too tight. If you wrap the bandage over your hand too tight, it will cut off circulation. So squeeze one of your fingernails and count 1 to 5 to check if it is too tight. Within 2 seconds, the color should return to your fingernail. You should loosen it if it doesn't. So next is wrap beyond the site of the injury. So wrapping the injured region helps to ensure that pressure is administered evenly. So compression bandages are used to apply pressure to a specific area or injury. They help minimize the swelling by keeping fluids from gathering at the injury site. Next is use a sterile or new gauze or roller bandage. Reusing a gauze dressing or roller bandage can lead to an infection. So lastly is avoid bandaging a wound that is infected. If the injury site is red, hot, swollen, or tender, you might have an infection. So yellow or greenish pus, fevers, and chills are additional signs of infections. So next is let's move forward to how to manage splints. So a splint protects a broken bone or other injury. If you have a removable splint, follow your doctor's instruction and only remove the splint if your doctor says it's okay. So, splint and your skincare. Never put anything under your splint that could scratch your skin. So if your splint cannot be removed, blow cool air into it using hair dryer or a fan to help ease the itching. So next is do not use oils or lotion near your splint. So if the skin around the edge of the splint gets red or sore, you can pad the edge with a soft substance like moleskin or cover the edge with a tape. So next is if you're permitted to take your splint off, make sure your skin is dry before you put it back on. So be careful not to put splint on too tightly. So lastly is check the skin under the splint every day. So if you can't remove the splint, check the skin around the edges. Tell your doctor if you see redness or sores. So let's move forward. Water and your splint. So keep your splint dry. Moisture might gather beneath the splint, causing discomfort and itching on the skin. So moisture under the splint can risk the infection if you have a wound or have undergone surgery. So next is taking a bath. When taking a bath or shower, cover your splint with a sheet of plastic. You can also take it off while bathing unless your doctor says so. So next is splint off. If you can remove the splint while showering, pat the region dry afterward and put the splint back on. So if you can take the splint off when you bath, pat the area dry after bath and put the splint back on. So last is the wet splint. If your splint gets a little wet, you can dry it with a hair drying. Use a cold setting. So let's move forward. Prevention getting water inside your cast. So, the purpose of a cast is to immobilize and protect a broken bone or joint. Its purpose is to keep the broken bone in appropriate alignment while it heals, preventing it from shifting. So, first, a doctor may want the patient to use ice. So, the reason of this is to help decrease the swelling of the injured body part. So next is put ice inside a sealed plastic bag and place a towel between the cast and the bag of ice to keep the cast from becoming wet. Next is apply ice to the injury for 15 minutes each hour for the first 24 to 48 hours. Then next is try to keep the cast in injured body part elevated above the level of the heart, especially for the first 48 hours after the injury occurs, because elevation will help to decrease the swelling and pain at the site of the injury. Then lastly is propping the cast up on the several pillows may be necessary to help elevate the injured area. especially while asleep. Let's proceed. Prevention for a cast from breaking. So first is loose cast. If the cast becomes very loose as the swelling goes down, call the doctor for an appointment, especially if the cast is rubbing against the skin. Next is protect the cast from water. So to bath, wrap the cast or cover it with a plastic bag and check the bag for holes before using the bag for a second time. So plastic bags with Velcro straps or rubber gaskets help to seal out water for protection during bathing. So next is fiberglass cast and water. If a fiberglass cast gets damp, dry it. Make sure it dries completely because a fiberglass cast enables air to pass through it. A hair dryer set to cool should suffice it. So next is very wet undercast. Contact your doctor if the cast becomes so wet that the skin beneath it becomes wet too. When the skin is wet for an extended period of time, it can break down and get infected. Because if the skin is wet for a long period of time, it may break down and infection may occur. So next is odor in a cast. Sweating enough under the cast to make it damp can lead to the growth of mold or mildew. So, call the doctor if mold or mildew or any odors come from the cast. So next is don't break a cast. Do not lean on or push on the cast because it may break. So next is do not put anything inside the cast. Do not try to scratch the skin under the cast when it itches with any sharp objects because it may break the skin under the cast and lead to an infection. Do not put any powders or lotion inside the cast also. Next is don't trim the raw edges of a cast. Do not trim the cast or break off any raw edges because this may weaken or break the cast. If a fiberglass cast has a raw edge, use a metal file to smooth it. If a raw places irritate the skin, call the doctor for an adjustment. Next is use an arm sling. An arm sling may be needed to support if the cast is on the hand, wrist, arm, or elbow. So wrapping a towel or cloth around the strap that goes behind the neck can help protect the skin on the neck from becoming sore and irritated. So next is do not walk on the cast. If the cast is on the foot or leg, do not walk or put any weight on the injured leg unless the doctor allows it. So next is walking boots. If the doctor allows walking in the cast, be sure to wear the cast boot if given by the doctor. So the purpose of the boots is to keep the cast from wearing out on the bottom and has a thread to keep people in cast from falling. So lastly is the crutches. Crutches may be needed to walk if a cast is on the foot, ankle, or leg. Make sure the crutches have been adjusted properly before leaving the hospital or the doctor's office. And make sure you understand and can demonstrate proper use of the crutches. So now let's tackle about the nursing assistant responsibilities. So first is the fracture. Number 1, maintain bed rest or limb rest as indicated. So provide support of joints above and below the fracture site, especially when moving and turning. So provide stability, reducing the possibility disturbing alignment and muscle spasm, which enhancing healing. So next is support fracture site with pillows or folded blankets. Maintain a neutral position of the affected part with sandbags, splints, trochanter roll, or footboard. So prevents unnecessary movement and disruption of alignment. Proper placement of pillows also can prevent pressure deformities in the drying cast. So hip, body, or multiple casts can be extremely heavy and cumbersome. Failure to follow properly supporting limb in cast may cause the cast to break. So next is maintain position of integrity of traction. So traction permits pulling on the fracture bone long axis and overcoming muscle tension or shortening to facilitate alignment and union. So, skeletal traction such as pins, wires, tongs permits greater weight for traction pull than can be applied to skin tissues. So next is ascertain that all clamps are functional. So lubricate pulleys and check ropes for fraying. Secure and wrap nuts with adhesive tape. So ensures that traction setup is functioning properly to avoid interruption of fracture approximation. So next is keep ropes unobstructed with weights hanging free. So avoid lifting or releasing weights. An optimal amount of traction weight is maintained. So ensuring free movement of weights during patient repositionings, avoid sudden exist pull on traction with associated pain and muscle spasms. So next is assist with placements of lifts under bed wheels if indicated. So it helps maintain proper patient position and function of traction by providing a counterbalance. So next is position the patient so that appropriate pull is maintained on the long axis of the bone. So it promotes bone alignment and reduces the risk of complications such as delayed healing and non-union. So next is review restrictions. Review restrictions imposed by therapies such as not bending waist and sitting up with back traction or not turning below the waist with Russell traction. So maintain integrity of pull of traction. Lastly is check for sign of infection. So an infection after fracture will usually cause increased pain, warmth, redness, and swelling around the affected area, more than what is considered normal. So, in addition, a pus pocket may form and if it bursts, pus will drain from the injury. You may also have a fever, chills, and night sweats. So next is the nursing assistant responsibilities for bandaging. So first, nursing assistant should place patient in a comfortable position. Second is the position of the part to be bandaged should be well supported and elevated if necessary. Third is check bandage regularly to ensure that the bandage is still comfortable. So fourth is check the bandage remains firmly secured. And lastly is secured bandages with tape, clips, a bow, or a square knot. So now let's proceed to the nursing assistant responsibilities for splinting. So first, elevate the limb with a splint. Second, check skin daily for redness, sores, and contact fracture clinic immediately. Third, check straps are firm but not tight and are supporting the injury. Fourth, check position of splint and it is supporting your injury. And lastly, educate the patient on proper splinting care. So lastly is the nursing assistant responsibilities for cast. So first, use proper hand hygiene. Second, remember that your patient is a person. So explain everything you are doing to them. Third, support the cast on a firm yet soft surface as it hardens. So be sure to only touch a damp cast with the palms of your hands. So fourth, frequently check the skin around the cast edges, then keep the skin dry. So next is educate the patient on proper cast care. So document the response to the cast application as well as your counsel. So next is do not put a damp cast on a hard surface or anything with sharp edges. And then lastly, don't let the patient use anything to scratch under the cast because it can increase risk infection among the other things. So that will be all. Thank you for listening and God bless.